June 23rd, 2020. It's a regular but remote meeting of the Board of Health. I look forward to face-to-face meetings soon because I'm not face-to-face right now. And hopefully we will be able to do that in the near future. We have on the line here David McSweeney, our Vice Chair, Wayne Saltzman, Board Member Libby Wallenjevich, and again, Board Member Mary Beth Welch is not going to be attending this evening. Also, we have Susan Luminello, Director of Public Health, Christine Mathis, Environmental Engineer. I think I see Dawn Cathcart. Is she on? Our recording clerk.
Yes, I'm here.
Thank you, Dawn. Thank you very much. Sarah Quartermash from the Board of Health Administration. And I think I mentioned Susan Luminello, our Director of Public Health. We are operating in a declared state of emergency with special rules. As we have done in the past, Mr. McSweeney will provide the legal requirements for this evening.
Thank you, Mr. Chairman. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law 30A, General Law Chapter 30A, Section 20, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Burlington Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to or view this meeting while in progress may do so by turning into BCAT, Government Cable Access Channel, the BCAT Government Meeting Facebook live feed, or over the telephone at telephone number toll-free 408-418-9388, meeting number 129-897-2492. That's toll-free number 408-418-9388, meeting number 129-897-2492. A reminder that persons who would like to listen, I'm sorry, I already said that. Also, we will be monitoring the comments on Facebook Live to see if there were any that the board made us to address. And as a reminder to all board members that all votes are required to be done by roll call for virtual meetings. And with that sloppy reading, I will turn it back over to the chair.
Thank you very much. As we've done in the past, our board member, Libby Wallenjevich, will lead us in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. The next order of business is citizens' time. Is there anybody on this call who is not on the agenda who would like to speak to this board? Is there anybody on? I guess it's Sarah Gortamash. Have you seen anybody? Does anybody want to speak to this board?
I don't see anyone at the moment.
Thank you very much. The next is the chairman's report.
Mr. Chairman,
Yes.
you skipped the minutes, approval of minutes.
Oh, I'm so sorry. Thank you so much. Approval of minutes, May 26, 2020.
Mr. Chair, I wish to make a motion to pass approve the minutes from that date.
Second, May 26,
The date is-
2020.
Yes, May 26, 2020. Do I have a second?
I second, Mr. Chairman.
I have a motion, a second. Is there any other discussion on this? If not, then I'll call for roll call. David McSweeney,
Aye.
Wayne Saltzman,
Aye.
Libby Wallenjevich,
Aye.
and I vote aye. All right. Chairman's report. These times continue to be extraordinary, but we are getting there. COVID-19 cases are declining. Our town has and continues to face continued and new challenges every day. But as I've said a number of times, I'm proud that we are meeting all of these challenges head on, using plans that we developed and drilled and practiced months and even years ago, while also employing novel and some real innovative solutions. Our Board of Health staff and Medical Reserve Corps continues to work every day to ensure public safety, and I've mentioned those names many, many times. Before we begin, I have to again thank our staff, many volunteers, and elected board members. I want to also thank, and we are blessed by our Medical Reserve Corps volunteers that have provided outstanding service to the town of Burlington. Over the past month, with your help, we were able to assist in a successful election day and town meeting. At the town meeting, we were thanked by multiple town officials for what we have contributed to this community. They also singled out our director, Susan Luminello, as outstanding. Our 2021 budget was approved by town meeting. The vice chair, myself, and staff have taken part in a subcommittee meeting. There have been many state Department of Public Health teleconferences, which we have attended, specifically those multiple calls per week around COVID-19 and our reopening within the Commonwealth, and also a very interesting one on Eastern equine encephalitis. I gave insight with an email recently providing them what I feel was state direction, and we heard a little bit of their response to that direction on today's call. The Burlington Union published a story about the reopening of the Commonwealth featuring the Board of Health. And I thank everyone for their assistance in this pandemic and state of emergency. With that, there are no subcommittee reports. So we'll go to permits. Biological safety permit, Millipore, 400 to 600 Summit Drive. And I have listed here as Bobby D. Young, who is going to be the presenter. Is that correct? Terry Natalie, are you the person that's going to be presenting?
No, Bobby was just there. Sorry, Harry, this is Lisa Hartman with Millipore Sigma. Bobby, are you there? I don't see you on the bottom.
Yep, I'm here.
Okay, perfect.
Oh, there you are.
Yep.
Would you? I know that you have prepared a report and a visual PowerPoint presentation. I'm going to ask our administrator, Sarah, can you put that up by any chance?
Thank you.
So Bobby, you have the slides to put up, correct? Are you able to upload them?
Okay. I have them here. I was just, hold on. I thought Christine had mentioned that you were going to drive for me, but let me find them.
Sarah, don't you have the presentation to load, and Bobby's gonna have the application to load if
Yeah.
needed?
Oh, I can certainly upload it. I thought it was too many pages.
No, just the
No, just a PowerPoint.
Just the power.
presentation.
Can you see my screen?
Yes, I can.
Let me put it to PowerPoint. Well, good afternoon, good evening rather, Mr. Vice Chair, members of the board of the Burlington Board of Health. I want to thank you for allowing us to come before you this evening, and I need to get my dog to shut up. Sorry about that. I work with Christine Mathis for the regulatory side of Burlington. We do the health report, and also the biological safety permits. Also, we were grateful for the extension of our existing permit until we can till the town finalize the new regulations. So we have those, and our new permit that we submitted for renewal is in line with the new Burlington Board of Health regulations. With that said, I'll move on to the next slide. I'll do some introductions. I have an outline here. Introductions. I'll introduce you to the people that are involved with the IBC and also the EHS management team and property managers, and we have a consultant that works with us as well. Guidelines and permit fees. Pathogen, I'll talk about that a little. Chemical hygiene program, EC members, and most importantly, our biosafety resources. We do the regulatory work to make sure that we're in compliance. Our biggest thing is to make sure that we have the resources to ensure compliance with the town of Burlington and for Millipore Sigma. And lastly, we'll show you our control program. Introductions, Amanda Gavazzi, she's the property manager. Last year we had Jackie Lake, and she attended the meeting with me. This year we have Amanda Gavazzi as her successor. I'm Bobby Young, the EHS engineer consultant. Sarah Wilson is our EHS consultant that works with us from TRC. Tyson. Lisa Hartman is the head of EHS. Guidelines and permit fee. The town of Burlington's new biological safety regulations. We are abiding by those. We also follow the NIH guidelines for research involving rDNA molecules as a requirement of the town of Burlington biological safety regulations. The permit fee of the $750, we submitted that to the Board of Health already. We have no projects requiring registrations at this time. Our annual meeting of the IBC was on March 6, 2020. We had a facility walkthrough with Christine and Mr. James Harris. There was no major findings. There were some minor findings that we've implemented corrective actions for. Those have been submitted to Christine. Biological biosafety and bloodborne pathogens program. That's basically our training core program. We have must have biosafety training within 90 days of assignment every 3 years after. bloodborne pathogen training within 30 days of assignment and every 3 years, every year after. Okay, that's going backwards. Here we go. Medical surveillance. This service is outsourced to Mount Auburn Hospital in Cambridge at the moment, but we will be looking into bringing that in-house because we have a new occupational health services nurse that will be taking that over for us. Her name is Amanda Loftus. Our waste disposal program, we have on-site and off-site disposal methods are addressed in this program as well. We use Stericycle as our off-site disposal company. We've been using them for quite some time now. The chemical hygiene program, this program contains the contents of our health and safety manual. It covers like safe handling of chemicals or address, chemical disposal requirements, and labeling. Labeling, I'll emphasize that that's global harmonization labeling, that's for all of our secondary containers. Our biosafety resources, we have Environment, Health, and Engineering, Inc. On purchase order agreement with us. We also use APSA, the American Biological Safety Association, ATCC, the American Type Culture Collection. We buy a lot of biological material from them, and they are a very, very good source for risk assessments, and because they provide everything that you need to know to make an informed risk assessment for the employees that are going to be handling the biological material. And it's very well documented. Once you purchase the material from them, they have SDSs for biological materials. They have the certification statements for the material, everything that the EHS professional needs to make an informed decision on risk that's associated with their products. TRC, Sarah Wilson is with TRC. We have them on purchase order as well. So whenever we need something that's outside of our area of expertise, we can reach out to them. And we also have subject matter experts in-house. We have quite a few PhD microbiologists that are at our disposal as well. So we're well equipped when it comes to making decisions on how to handle the biological materials that we use. Our highest level of biological is biosafety level 2. We have done some biosafety level 2+ at Burlington. This slide is a little small with the font.
Okay, here's a quick question. What is biosafety level 2+?
It's an enhanced level of biosafety level 2.
Do I get that? What does it mean specifically?
Specifically, the area that the work is being done in is controlled access. We have like card access entries for the area. It meets all of the biosafety level 2 and safety level 2+. We have the control access for it.
Thank you.
Okay. And this slide is a little small to read, but it lists our IBC members. Most of them that I've talked about in the previous slides. The two that I want to emphasize on is per the regulations. We have Christine Masters and James on the list, as well as town members, town officials. Our pest control program. We have JP Pest Control Services out of Milford, New Hampshire. They do interior and exterior. Target pests is rats, mice, stored product pests, crawling pests. So along with our permit renewal, we submit all of the pest control tests or results that they do through the year. That's part of the renewal package. And they do a good job at keeping the pests out of our building. This is a snapshot of what I was just talking about with the control access. This is a floor plan, a partial floor plan of our biosafety labs. And here's a corridor that's on both sides. And you can't see it back here, but the entry into the corridor, there's card access. And also to get into the biosafety labs, there's a card access outside. And as you can see here, there's one on this side of the corridor and there's one on the other side of the corridor. So you can't get in without having access or having been approved to get into the area. And that concludes my we all, I think, heard everyone talking about coronavirus. So I encourage everybody to stay safe. Stay safe myself. We at Millipore Sigma received the notice from the town of Burlington, following the Massachusetts guidelines for reopening. We have all of those in place, so we're doing the right thing. This time, if there's any questions on what I just presented, try to give you an answer.
This is Ed. Christine, there are 6 new categories of bullet points that have to be fulfilled to get the license. Christine, can you tell me, have they fulfilled all those categories? Christine,
She's on mute.
you're on mute, Christine.
Sorry. Yeah, those categories were submitted as part of their application.
Okay, thank you very much. Wayne, you have a question.
I do. I don't mean to. Thank you, Mr. Chair. I don't want to harp on this, but Christine, biosafety level 2+, if I recall, not recognized by the CDC or the NIH, and so and it has some biosafety level 3 components to it. I just want to make sure that in the permit, we are cool in general with biosafety level 2+.
Yeah, I think from what I've read, it is the controlled access addition, in addition to the standard biosafety level control measures for level 2. But prior to permit issuance, I will double check that.
Yeah, because I thought there were just some practices and procedures involved in it from biosafety level 3, but it's referring to a biosafety 2 laboratory, but with advanced procedures. I just want to make sure it just was a term that I haven't heard used before, and I want to make sure that we were cool.
Yeah, the BSL-2 came about by Harvard, actually. It's been kind of mainstreamed into the biosafety community. I just wanted Bobby to confirm. So I know, Bobby, we have 2+ in Bedford occasionally, but I did not know we had 2+ in Burlington right now. Oh, you're on mute. Sorry. Bobby? think we lost him. He'll come. Oh, I know we've done some 2+ work over in, I don't know if we've done any in Burlington. So I think Bobby, I just want to confirm that.
Hold on a second. Can you hear me?
Okay. Yeah, okay, now, yeah,
Yes,
you're kind of funky colored now.
The 2+ work was the lentivirus.
Yep,
We submitted the registration for that.
okay. And was that up in PTI or BioReliance?
That was in Ronnie's group there.
BioReliance, okay. So that's the one, I just want to point this out too, because that's the one that Bobby showed you the map with the extra security in it. Just so you're aware of that, just to connect those.
Okay, so that is
Those dots.
a safety level that we're using in Burlington now.
Excuse me?
So Bobby can speak to this. I don't know, is Ronnie still doing that research?
I've never heard of it, and
They
I
aren't
just
doing it, they aren't doing it continuously, but they have done it,
Okay.
and they do get work periodically on that level.
Okay. Okay, so it's coming in
Yeah.
from probably a client then, because that's what BioReliance handles, client material.
I don't know what any of that means. I just want to make sure that
Okay,
that
yeah.
our environmental engineer is cool with this permit accepting level 2, and if she is, then I'm good. I hadn't heard it before,
Absolutely.
so it was
Yep.
a surprise to me. Thank you.
Ask a question regarding that?
Go ahead.
Okay. So I'm curious, I just want to know, so biosafety level 2+ means extra security precautions. Does that mean, and the key cards, does that mean that are you always using the key cards, or you only use the key cards when you're doing biosafety level +2?
The key cards are always there anyway, so it's not as we use it when we need it for biosafety level 2. The key cards are part of the design.
So I guess the question is, are you using biosafety level 2+ precautions regardless of what type of procedure you're doing?
Yes, those precautions are always there.
Okay.
So,
My question, Susan, was that I wasn't aware that it was a recognized safety level. Never heard of it before. So I may be commonly used, but I didn't see it as part of our permit. So I just wanted to make sure that I don't want to beat a dead horse, but I just want to make sure that we have full understanding of what's going on in town.
I agree, and I wasn't aware of it either. But I think we would require the security precautions regardless. That's a question that we would have asked tonight anyways, like, are you using key cards? So
Yeah,
we would have looked for
key
that.
cards are part of the design.
Yeah.
Any other questions?
I just want to make sure that Christine, you are satisfied with the submission.
I am.
Okay, thank you. Do I have a motion to approve the biological safety permit for Millipore 400 to 600 Summit Drive?
So moved.
Do I have a second? Do I have a second? Well, I think that either Libby or David, you're on mute. Do I have a second?
Second.
Libby seconds it. Is there any other discussion?
Yeah, the only discussion, Mr. Chair, is that our environmental engineer just confirms what exactly is happening with regard to biosafety level 2.5 for our records.
Okay, thank you. With that, and you'll do that, Christine?
I will, Ed.
Thank you so much. I'm gonna put it to a vote. David McSweeney? David, are you on mute? Sarah, can you unmute David?
David is unmuted. He may be having some technical.
Yeah, there's a lot of technical difficulties tonight. David, if you, can you vote? We can't hear you. He thumbs up, so I'm going to take that as a positive vote. Ms. Wallenjevich,
Aye.
Wayne Saltzman, Dr. Saltzman,
Aye.
and I vote aye, 4-0. Those from Miller, thank you so much for attending. We really appreciate you coming here tonight. And I'm sure that Christine will be in contact with you to just get that final detail. So thank you so much, and we appreciate you coming. Be
Thank you
well
for your
and
time.
stay safe.
Thank you.
Thank you.
Thank you. Bye now.
Bye.
Have a good night.
You too.
I think you can at least see my face.
Can you, this is David. Can you hear me now?
Yes, we can.
Sorry about
Okay.
that. I am having technical difficulties.
And
Apologize.
confirm that you voted yes.
I did vote yes. Yes. Thank
Yes.
you.
Yes, with your thumbs up. Variance, external grease trap interceptor, Burlington Creative Start, 56 Middlesex Turnpike. Do we have somebody who will represent them at this time? Is there somebody who
I
will
think she's on mute. Is it Terry?
I believe it is Terry. Let me unmute her. She's unmuted.
Hello, hi, this is Terry.
Hi, Terry. Thank you very much. Your full name, please, for the record?
Terry Natali.
Okay, thank you so much for coming. I guess, Christine, you'll be presenting this, or will our director?
Yes, I will.
Okay, thank you.
Yep. So Terry is here for an external grease interceptor request for variance from Section 4, Part A of the regulations. The business is a daycare center, and they don't prepare any food on site. It's prepared and delivered by a third party and brought to the site. They do have a food permit because they need to warm up food. So the recommendation is to approve the variance from Section 4, Part A, and allow the new food service establishment to operate without installing an external grease interceptor. The one condition. And I can read that condition if you want me to, otherwise it's in the materials.
Why don't you quickly read it?
Okay. The food service establishment operator and the property owner both understand that the variance may be subject to revocation, suspension, or expiration as determined by the Board of Health. A variance under these regulations may be revoked, modified, or suspended only after the food service establishment has been notified in writing and given an opportunity to be heard at a regularly scheduled meeting of the Board of Health. Reasons for revocation, modification, or suspension of a variance include, but are not limited to, determination that the food service establishment is discharging grease in quantity sufficient to cause sanitary sewer line blockages or increased maintenance of sewer lines.
Thank you very much. Does anyone want to speak on this, Dr. Saltzman?
No, this, Mr. Chair, this, they're receiving food from off-site to serve, so their generation of fog, which we call fats, oils, and grease, appears to be significantly not significant. So, Mr. Chair, I actually would make a motion to approve the variance from Section 4, Part A for Burlington Creative Start, 56 Middlesex Turnpike.
Second.
So I have a motion, a second. Any other comments? I have one. They will have and I'll ask our director, they will have an internal grease trap,
Yes, they will, as that's required. Yep.
and will there be a grease trap log internally for that internal grease trap?
Yes, and Terry, I believe Marlene went over this with you, so you understand the log.
Right, yep. Correct.
When she does an inspection, please make sure that you keep that log up to date, because you'll have a real problem, Ms. Natali, if you don't have it up to date and she comes and does an inspection. Because if we revoke this, it'll be devastating to you. So it's very important you do this. You understand why we have to do this.
Yeah, and we have other centers that we keep the log, so we're familiar with it.
Thank you very much. I have a motion. Did I have a second also?
You did. Libby seconded. Mr.
Livni
Chairman.
seconded.
Yeah.
No other discussion. If all in favor, David McSweeney,
Aye.
Dr. Salzman,
Aye.
Libby Wallenjevich,
Aye.
and Ed Weiner. Aye, 4-0. Thank you so much for coming.
Thank you.
You're all set.
Thank you.
Thank you. Staff reports. Environmental engineer. Do we have? Please, Christine, is there anything you'd like to highlight?
Sure. I was going to just pass on the information that the selectmen have enacted a different water ban, and that is watering is only allowed on Tuesdays and Saturday nights from 6 to 10 p.m. And I also want to emphasize that that water ban applies to people with private irrigation wells also.
Have they been notified?
We're working on that right now. We're putting the list together. We're updating the list, and then we're going to send out a mailing.
Thank you.
During the past month or so, I've continued doing COVID-19 related inspections and follow-ups, reacting to complaints mostly related to mask wearing, social distancing, and following proper reopening procedures for those non-essential businesses that have been allowed to reopen in the last couple of phases. And then I was going to give you a quick overview of the Tripoli update that we received recently. So mosquito testing started on October 15th. June 15th, and will continue to the end of October. Currently, no cases have been found in the first round of testing. Arlington's Tripoli risk is currently remote. They reviewed that, as you know, 2019 was an active Tripoli season with 12 human cases, and it's assumed that that 2019 may be the beginning of a 2 to 3 year cycle, because that's how Tripoli usually works. The state and the local mosquito control projects, which we are a member of one, they have increased trapping. They are working to reduce time between trapping and testing results becoming available. They did advanced larviciding operations, and they're increasing public communication tools. Their projection for this coming Tripoli season is that weather patterns over the past 8 or 9 months point to it maybe being a good season for Tripoli again, in that we had a wet fall, a mild winter, and a rainy April, which will contribute to the mosquitoes that carry Tripoli being able to survive over the winter season. A cool spring will help possibly shorten the season for the mosquitoes, but we'll have to wait and see.
Thank you very much. Are there any questions? Are there any questions for our environmental engineer?
Mr. Chairman, I actually have one. I just noticed that, well, not just noticed, but you have a septic removal of 4 Maryvale, and then there was a possible contamination of 4 Maryvale. I'm assuming it's linked somehow. Can you just talk through that, Christine?
Yeah, it actually wasn't.
Oh, okay.
It was a historic release of home heating oil. And since the property is being turned over, they're taking out the septic system and demoing the house. But somebody looking to buy the property was looking at the past environmental impacts. It was just
Gotcha.
coincidence.
Thank you.
Libby or Wayne, do you have any questions? I have a couple.
No,
Not, Mr. Chair.
Okay, I'll go ahead. First, investigations. There were 3 drainage investigations. Are any of those some of our historical issues, our problems?
One was, and that's in the paperwork provided. They were issued a order letter, a fine, reinspection was done. The discharge hose had been removed, and they in fact paid the fine.
Is this the continued problem that we have?
Yes, it is.
Okay, thank you very much. And then the other question I had was, when you did, we heard some very interesting information today. I'm sure you were also on the call today with the Department of Public Health about post office employees. And were you aware at the time? I was quite surprised that federal employees are exempt from Massachusetts COVID laws. And
I was also surprised, and I was not aware at the time that I contacted the post office, nor when I did my inspection. But they were fully cooperative. I told them what the guidelines were for mask wearing, and they did not mention to me. They did not object. I spoke to 2 different managers there, and both said that they would, reinforce with their employees how to properly wear a mask, and that they were requiring it of all employees. So I didn't get any pushback. And in fact, when I did my inspection, all the employees I saw were properly wearing masks.
Thank you.
Mr. Chair, I have been in the post office a number of times for just my own personal business. They have always been wearing masks and taking precautions. They also have plexiglass in place. But I have to say, as an aside, that we're very fortunate as a town to have such an amiable and collegial post office on Center Street. And so I am not surprised at all to hear that they were more than happy to work with our environmental engineer and our Board of Health in complying as close as possible to the Massachusetts COVID laws.
Thank you very much. I've had good experience too, but it was just a comment that we heard today that federal employees were exempt, which caught me quite off guard, as everyone else. Well, anybody else any comments? If not, I'll put it to. Do I have a motion to approve the environmental engineer's report?
so
So
moved.
moved. Second.
Okay, so I have a motion by Dr. Saltzman and 7 by David McSweeney. All in favor? David?
Aye.
Dr. Saltzman, Wayne?
Aye.
Libby Wallenjevich?
Aye.
And I vote aye, 4-0. Thank you so much. Which brings us to the Director of Public Health. Susan,
Yes, thanks.
is there anything you'd like to highlight?
Yeah, I just wanted to talk a little bit. As you all know, on Monday, we went into phase 2, part 2, or step 2. So the changes for this phase include the allowance of indoor dining. So, and also office space has now been allowed to be increased for occupancy from 25% to 50%. And also has allowed some close contact personal service like nail salons and tanning salons. So we're working now this week, and as we have been all along, with different departments, different businesses on the reopening. The indoor dining aspect of it, we're trying to get through and do inspections of all of our food services restaurants that are open. Some of them are not. Some of them have decided, even though it started on Monday, they need a little bit more time to prepare. So they may not be opening right away. It may not be this week, but maybe next week. So some of it has been a little delayed in what they're doing. Also been working with other town departments on trying to speed along the requests that different restaurants and other establishments have had as far as how to comply and how to get approval from the town for certain things. So for the outdoor dining, some fitness classes have come forward and said they'd like to have outdoor classes, which they can have as long as they have less than 10 people. They're 6 feet apart. They just can't have the classes in their studios. They're looking for areas to do that. So working with other town officials on where they can do it. One class has come forward asking if they can do it in the parks at certain times. So we're trying to, make the process as easy as we can for local businesses to get back up and running.
Thank you very much. Do we have any questions for our Director of Public Health? Do you want to take 1 minute, because she might be watching, to say something about Kathy Piccolo, one of our Board of Health clerks who will be retiring on Friday? So in case she's watching.
Yeah, we're all going to miss Kathy so much. Friday is her last day. We are going to have, if you all want to tune in on Friday, Sarah had sent you the information just to say farewell to Kathy. If you want to call in on a certain time, say farewell to her. But she has been just instrumental in everything that we do with the Board of Health. She's worked so closely with the Medical Reserve Corps. So many of the volunteers have got to know her, and they're going to miss her as well. She has been the voice of the Board of Health for so long, and there's going to be a lot of people, not just our department, other departments, and on the Medical Reserve Corps, really are going to miss her. And we wish her the best, wish her a happy retirement. And again, we'll keep in touch with her, I'm sure. But we're going to miss her a lot.
Thank you very much. I hope she's watching. Do I have a motion to approve the Director of Public Health's report?
So moved.
So I have a motion by David McSweeney, second by Wayne Saltzman. All in favor? David McSweeney,
Aye.
Wayne Saltzman,
Aye.
Libby Wallenjevitz,
Aye.
and Ed Weiner, aye, 4-0. Brings us to discussion. Is there anything that you'd like to bring up tonight before we adjourn?
Mr. Chair, if I may.
Sure.
Uh,
Dr. Saltzman.
Mr. Chair, I was, as you and I had spoken a couple of weeks ago, I was prepared tonight to deliver a rather impassioned plea regarding the Board of Health supporting the idea that racial disparity, social inequity in our town and beyond was a public health issue. I still want to. My plea won't be as impassioned, but it is still something that I wish for the board to consider taking up. And it's not as impassioned because while I thought that I was heralding a new effort in the state of Massachusetts. Marty Walsh, the mayor of Boston, put out this thought, and then Councilman Arroyo from the Boston City Council also put out this thought. And throughout our country, there have been a number of individuals and systems and towns and cities which have declared that racial inequity, social injustice is really a public health issue. So it kind of took the wind out of my sails. Nonetheless, I do wish to submit for further discussion and for the idea of a program or some aspect of leadership in our town by the Board of Health that we take up this issue as a public health issue. I think this is important. I think this marks the future of our town. I was present at the rally, at the protest regarding Black Lives Matter that we had. The former Burlington school system students who spoke on behalf of Black Lives Matter were extremely passionate. Their stories were palpable. And I left there thinking very differently about our town than I had initially. And I thought that our town could use the help of the Board of Health, as we have helped in so many other ways, in order to address social injustice and inequities that clearly do exist, that are not discussed, but do exist and need to be addressed. So I would leave it there. I would just ask that that the Board of Health support this idea and direct our Board of Health director to consider this as well, and potential future programs or initiatives that we can support either alone or working interdepartmentally with the remainder of the town and the schools on this issue.
Thank you very much. As you know, our board has a long history of working with healthcare disparities and the formation of one of the first free clinics hosted by a board of health in the country. And I second all that you have said because I feel very passionately about the subject and the issue. So thank you very much for bringing it up. And I hope that this discussion continues and we find a way of doing something more concrete. Thank you so much.
Mr. Chairman,
Yes.
I just wanted to add to that. So the state, I believe it was today, they released a report from the COVID-19 Health Equity Advisory Group that just came out today. And we have it posted on our website. It's on the COVID-19 page under recent updates. So if the board members want to take a look at that, that might give us some ideas of, what we can do around this subject matter. But if you go to our website and click on that link and look at it, that might be one way that we can have discussion about it.
In addition, I have spoken and very briefly with the superintendent of schools, and we should have continuous dialogue with him. Maybe we can do this town-wide. So anyway, thank you so much, Susan. That's great. Step in the right direction. Dr. Saltzman, you needed to say something else?
Mr. Chair, thank you. I wish to change subjects and just to say something in brief regarding the current status of COVID-19. I'm very proud of our town. I'm very proud of our community and for the businesses that make up our community in helping all of us to manage this crisis. As everyone knows, we are post-surge. As our director has mentioned, we now are in part 2 of phase 2. Things are opening. I would like to express some caution as I'm compelled as a medical professional to do so. And my caution is that this is not over. And while we are working towards trying to assess what is the new normal in our community, we have not reached normalcy. So, in fact, Dr. Anthony Fauci, who has been the face of public health for our nation with regard to COVID-19 yesterday said a question of whether or not we were in phase 2 of, or a resurgence, wave 2 of COVID. He said, we have 30,000 new cases in this country a day. We are still in wave 1. So this is still an ongoing issue. I would urge everyone with the habits that we have formed over the past 3 months, the habits of standard precautions, hand washing, protecting our sneezes and coughs, protecting others when we don't feel well, cleaning surfaces, social distancing, wearing masks. We have done a great job. In the past 24 hours, there have been, despite the fact there have been deaths, there were only 14 deaths associated with COVID-19. We have less than 950 people in Massachusetts hospitals currently because of COVID-19. We've done a great job. Please do not become complacent. Please do not change your practices. Please do everything you have done before as part of the new normal, and we will be successful as Massachusetts reopens and as our town tries to understand what is the new normal. Thank you, Mr. Chair.
Thank you very much. Very well said. Anybody else would like to comment?
Mr. Chairman?
Sweeney. Yes.
Yeah, thank you. I appreciate it. Changing subjects a little bit, and Dr. Saltzman, I do want to thank you for both those points. Very important. Very much support. Your first comments around, making the disparities in economic and race a public health issue. I do believe it is, and whatever we can do, I'm in full support, and also would like to do anything I can to help support that mission from the Board of Health. The second thing I'd like to comment on, and still important, probably less important to Dr. Saltzman's, is just a reminder to the residents that we just this week got 2 reverse information calls from, I believe, the DPW via the selectmen on water usage. And although they weren't mandated messages, they were sort of requesting to limit the use of outside watering and outside water usage. I think the call today was Tuesdays and Saturdays, 2 days per week. And again, I just want to remind the citizens that the water supply is not unlimited, and we are very much in the heat of the summer. And the last week has been, or last couple of weeks actually, we haven't seen any rain or minimal rain. I would just, urge the residents to, really, there's no need to be watering at all, but if there is a need to do it on a sparingly basis and to contribute back to the community, this valuable resource. So I'm sure at some point in time it's going to be a mandated cease of water usage, and although this doesn't fall under the board's purview, other than the well use, I do think we should support the other areas in the town in pushing that message out there. And in addition to that, I mentioned the wells. Those also, just as a reminder, those do also follow the same guidelines of the town water usage as well. So I just want to throw that message out there to remind the citizens.
Thank you very much. Well, we have completed another remote meeting. It's my hope that sometime in the next month or 2, we're able to come back live, sitting together, 6 feet apart. But until then, I want to thank everybody within this community for understanding the situation that we're in, understanding the pandemic, understanding the state of emergency, and please know that the Board of Health is doing everything it can to keep this community safe. With that, I'll ask for a motion to adjourn.
So moved.
Dr. Saltzman, a second.
Second.
Libby Wallenjevich. Libby, all in favor? Libby?
Aye.
Dr. Saltzman?
Aye.
David McSweeney?
Aye.
And aye. We are adjourned. Sarah, could you stay on for 1 minute? I'd like to just